Yeah, welcome back to the channel. Today, very important topic we are going to discuss, that is neonatal resuscitation. One of the important topic for both undergraduate exams and for NEET exam, very important topic. So let's crack it in a simple way. Okay. So we are going to follow American Association of Pediatrics. Fine. Okay. When you get a call from a obstetrician or PG from a OBGY department, then first thing you need to ask is what is the period of gestation, then color of amniotic fluid, then any other risk factors like diabetes or something. You need to ask maternal things. At birth, you need to look into term child or spontaneous cry is there or respiration, and even tone of movement of limbs, whether it is present or not, yes or no. If yes, then go for the routine care. If no, then you have to follow the guidelines which is given by AAP. Okay. So if there is no spontaneous cry or respiration, then what you'll do, don't be panic, follow the guidelines so that you'll save the baby. First you need to check the temperature, whether temperature is maintained or not. Then you need to give some tactile stimulation like rubbing on the backside back, so that it will give tactile stimulation. Otherwise, position of the airway and even suction if required. Usually we won't suction for every baby, but here we need to suction if there is excessive secretion. So you need to do it by mouth first, then nose. You need to remember M comes before N. Okay. Yeah. If after doing this, yeah, baby is like it is crying spontaneously or respiration tone is normal, then go with the routine care. Otherwise, again you need to follow the guidelines. So let's dig into it. Then you need to check for heart rate, then respiratory rate, color of the child. Color of the child plays important role because cyanosis. Okay. Yeah. Then we need to evaluate heart rate, respiratory rate, color of the child. Then in that we'll divide into two parts. If there is labored breathing is present, labored breathing or persistent cyanosis is there, then you need to check for SpO2. Start oxygen supply then with continuous positive airway pressure. If not, then go with, if there is apnea or heart rate is less than 100 per minute or any gasping is visible, then you need to go with the, first you need to check the SpO2, then if possible connect to the ECG monitor, then go with the positive pressure ventilation. One thing you need to remember in positive pressure ventilation is it is other name for bag and mask ventilation. Okay, nothing science, rocket science. Okay. Yeah. Then initial concentration of oxygen you are giving is like depends on the week, whether if the baby is above the 35 week, room air is sufficient. If the baby is less than 35 week, then you have to go with the 21 to 30% of oxygen. Then this is the main thing you need to remember. People tend to ask this one very importantly. If you are like able to remember these other findings, it's okay. Otherwise, it's okay, chill. Oxygen flow rate, it's 10 liter per minute. Ventilation rate 40 to 60 per minute. Then peak inspiratory pressure 20 to 25. Then positive end expiratory pressure 5 centimeter of water. So short form for this is P. Okay. Yeah, that is marker. Fine, adjust. Monitor the heart rate. Again, if the heart rate is less than 100, check for the movement. Ventilation corrective steps you need to do. So here we follow MR sofa, otherwise Mr. Sofa. What is MR sofa? Yeah, that's correct. Mask and mask readjustment you need to do. That bag and mask ventilation you was doing now, you need to recorrect it, reposition the airway so that air goes properly, and suctioning like there it was optional, but here it is compulsory, so that you clear out the excess mucus so that it won't obstruct the respiration. Then open the mouth, increase pressure. Maximum you can do is 40. Till 40 it's fine. Above that not allowed. Then you need to find out any other alternate airway like endotracheal tube or even laryngeal mask. This thing you will learn in anesthesia section. Soon I'll make video on these two things. Then again you need to check for the movement. If there is, it is present and positive pressure for at least 30 seconds, and even then there is no heart rate, like it is not increasing above 100, it is going below 100, most probably like below 60, then you need to go for chest compression So we will do it in a 3:1 ratio for every 2 seconds, not for 1 second. Don't make this mistake. People tend to make the mistake, like they'll say every 1 second. No, it's for a 2 seconds. Coordinate it with for 1 minute. Okay, then if still heart rate persists like below 60 per minute, then you need to go for epinephrine. Yeah, the life saver drug epinephrine in the dose of 1 is to 10,000. So we prefer three routes, like IV or intraosseous. You know, intraosseous, like anyway it enters the blood circulation, systemic circulation, right, through uh, uh, vessels present in the joints. So joints are like long bones. Then like in IV and intraosseous, we give 0.2 ml per kg, followed by we'll flush 1 ml of saline so that it goes rapidly. If you are giving a intratracheal, 1 ml per kg, followed by positive pressure ventilation, right? Then if still you did so much thing and still heart rate is below 60 minutes, then it is not issue with the resuscitation thing. There is some other underlying cause you need to find out. Most commonly it will be pneumothorax or hypovolemia. Yeah, okay. So important things, what and all you need to remember is heart rate. When we were writing the answer, you need to remember the heart rate things. It's like 160. Then Mr. Sofa is separate 3 marker. You need to remember that 3 marker thing. And coming to epinephrine dose, it is also very important. You need to remember, and the routes you are giving. So, and the doses. That's it. That's it. So I hope you people enjoyed the video. So subscribe to the channel. Don't miss out. Thank you.